So, good afternoon, everyone. We're here today to talk about some important developments in our fight against COVID-19 and to remind the public that COVID-19 is still real, is still present, and is still deadly. With me here today are Chicago Department of Public Health Commissioner Dr. Allison Arwady and Chicago Department of Public Health Medical Director Dr. Geraldine Luna. We all know these facts, but it bears repeating. All across the United States, there's been an increase in the number of COVID-19 cases, including in parts of central and southern Illinois and right here in Chicago. In the last couple of weeks, we've seen a steady rise in our daily case and test positivity rates, an increase that we believe is caused by the highly contagious Delta variant of COVID-19. Our average daily cases have risen to 80, when just a few weeks ago they hit a low for the entirety of the pandemic of 34. Test positivity rates were also hitting record lows in late June at 0.4%, but now the number is up to 1.5%. And while these rates are still below our peaks, it's still a concerning development that we wanted not only to stay ahead of, but to quash completely. And the way that we do this is by doing the right thing, the safe thing, and that is, ladies and gentlemen, getting fully vaccinated, and more of that in a moment. If we allow the virus to continue to linger here in Chicago, we will likely see further mutations, some of which our current vaccines may not be able to protect against, and have to reinforce some of the restrictions that have come to infamously define much of 2020 and part of 2021. The reality is this scenario, the worst case, is entirely preventable. And that's because we have 3 different vaccines readily available to all of our residents, which offer very good protection against Delta and other new variants. Let's think back. This time last year, it was harder for us to even imagine a reality where we had a vaccine, much less be able to walk up and get one for free at a neighborhood health center or pharmacy. But now we are living that reality, and many of you had taken advantage of the vaccine that's been available now since December of last year. And there are still folks who haven't taken up their responsibility to get vaccinated. The fact of the matter is, we're not just seeing an increase in the number of COVID-19 cases, we're seeing an increase among unvaccinated individuals and with areas of low vaccination rates. Locally and throughout the U.S., nearly all COVID-19 hospitalizations and deaths are occurring among unvaccinated people, meaning this pandemic is now targeting the unvaccinated. And let me be clear, when I talk about unvaccinated individuals, I include those who have not gotten both shots of 2-dose vaccines, like Pfizer and Moderna. And as we said time and time again, both shots are necessary to become fully vaccinated and fully protected. Until you get both shots, you are not well protected against COVID-19 and its variants. For example, folks who only got 1 dose of Pfizer are only about 34% protected against the Delta variant, while folks who got both doses are 88% protected. That's a marked difference. I also want to say this. What we're seeing in Chicago is in excess of 95% of the people hospitalized, and over 95% of the current deaths are also among people who are unvaccinated. When I first heard that, it was chilling. It's something I will never forget. And I want the members of the public not to forget it either. Vaccine isn't just a feel-good thing. It's about protecting you from sickness and death, and urging people to face the facts of this stunning reality and do what is necessary to mitigate that risk and protect yourself, protect your family, protect the community against the virus by getting vaccinated. Now, we're also beginning to see an increase in transmissions between unvaccinated residents who tend to be under the age of 40 and who live within zip codes 60621 and 60633, which represents neighborhoods on our south, far south, and west sides. So please, if you haven't done so already, and especially if you live in one of these zip codes, again, 60621 or 60633, it's time to get off the fence, to get in, get yourself vaccinated, but also importantly, stay masked up if you are not vaccinated. We are finally at a point in our COVID-19 journey where things have started to feel a little more like our normal, like the life that we lived before. But we were all changed for the rest of our lives by the experience that we've been through in the last 16 months. Last month, our city became the largest major city to fully and safely reopen because of all the hard work and sacrifice of so many people across our entire city in every neighborhood who followed the science, who were with us every step of the way and understood the necessity of making sacrifices and doing the right thing based upon what the public health guidance dictated. A milestone we were able to reach in safely reopening thanks to all of that work, and particularly thanks to our Department of Public Health, our local healthcare providers, our federally qualified healthcare centers, and so many who participated in the most equitable vaccine distribution plan in the nation. But we have more to do, and particularly because of the Delta variant. We can't allow it to spread further or faster than it already has, and it already has incredible momentum. We have to wait. If we don't stall this, we'll have to wait that much longer to be able to formally turn the page on COVID-19 and put this pandemic in the past, in the rearview mirror. Like I said earlier, this is a reality we can't avoid. It's a preventable. And the simple, easiest thing to do is to get vaccinated. Whether it's at your local health center, through your doctor or pharmacy, or even in your home, we are making door-to-door visits. If you're sick or infirm or feel more comfortable getting a vaccination in your own home, we will be there for you. I want to take this moment to remind folks that we have a number of city resources available that make getting vaccinated as simple and as easy as possible. One of them is Protect Chicago at Home. Right now, residents between ages 12 and older are eligible to conveniently receive any of the vaccines, Pfizer or Johnson & Johnson, within the comfort of their own home through an important appointment-based initiative. And what's more, up to 10 people can be vaccinated at a time, meaning that you can invite other members of your family, friends, neighbors to all get vaccinated with you. To set up an appointment, please call 312-746-4835. That's 312-746-4835, or visit chicago.gov/at-home. That's chicago.gov/at-home. Additionally, since our city is reopened, I know many of you are enjoying summer in Chicago and the return of our iconic fairs and festivals. But that doesn't mean this is a free-for-all and that people can skip out on being fully vaccinated and not following common sense guidance around gatherings. And let me use Lollapalooza as an example. With Lollapalooza starting next week, I want to also take this moment to remind attendees that there are other requirements that you must meet in order to get into this iconic music festival. Go to the Lolla website. They want you to be vaccinated or at a minimum show a negative test. So be prepared to bring your vaccine card or bring proof of a negative COVID-19 test within the last 72 hours before you go to Lolla. I can think of other surges, both in our city and across the country, that were significantly worse than the ones that we're seeing now. And the way we got through this is the same way we have to get through this now. By working together, following the science, listening to our public health experts, but also stepping up and doing your part to slow the spread of this deadly virus. Unvaccinated folks, I'm talking to you. Please, whatever you need to do to educate yourself, whatever you need to do to get comfortable, the vaccines are safe. We know that, both from the testing that was done, our own analysis, and the many hundreds of thousands of proof points in Chicagoans who have stepped up and gotten the vaccine. So please, if you're unvaccinated or you're not fully vaxxed, step up, don't delay, make an appointment, go and get a vaccine today. Now I'd like to turn it over to Dr. Arwady to say a few words. Doctor?
Thank you so much, Mayor, and thank you everybody for joining. I'm answering a lot of questions right now about COVID. I know a lot of you hoped that COVID was behind us, that you wouldn't see us up here talking again about numbers rising, that you wouldn't hear that the positivity is back on the increase, that you wouldn't be hearing more updates to the travel advisory. But unfortunately, that's not the situation that we're in. I'll start with the update on the travel advisory. 50 out of 50 U.S. states are now having increases in COVID numbers, COVID positivity. And as you heard just last week, we added our first 2 states to our travel advisory. That last week was Missouri and Arkansas, and we are this week adding Florida, Louisiana, and Nevada, as well as the U.S. Virgin Islands. And this shows here the map of those states. As a reminder, when states are on Chicago's travel advisory, people who are returning from those states should get a negative COVID test or quarantine upon return to Chicago. But if you are fully vaccinated, you do not need to worry about this. If you are fully vaccinated, you are exempt from that travel advisory because we have seen so clearly that being fully vaccinated is the most important thing you can do to protect yourself. But if you are traveling, particularly to one of the states in orange here, please know that the risk is high. And consider, even if you're vaccinated, adding masks to your repertoire. And please, if you're not vaccinated, do not travel to these states that are on the way up. In comparison, Illinois is at a relatively low 3 to 4 cases per 100,000 per day. Our cutoff here is more than 15 per 100,000 per day to get on the list. Here in Chicago, we're at 3.3. But unfortunately, the numbers are going up, and we're going to continue to monitor this. If we look at Chicago and where are we now from a risk perspective, so these are the same risk numbers and risk matrix we've been using all along. We're averaging 90 new cases a day every day. To remind you, we really want to keep that number under 200 and definitely under 400. I expect next week we will be over 100. We're seeing that increasing, but we're still in that lower risk territory. Our positivity is at 1.5%, which is good. It's in the less than 2% range where we want it to be. But just a few weeks ago, it was 0.4%. Hospitalizations remain at the lowest they've been since the beginning of COVID. We have just 83 folks with COVID in the non-ICU and another 27 in the ICU, single-digit number of people on ventilators. We are largely turning this into a preventable disease, but a vaccine-preventable disease. And as you can see, and if you want to look at this yourself, chi.gov/COVID-, you can see that just at the beginning there, we're beginning to see some uptick in our cases. Our low was 34 cases per day. 90 cases a day is good, but not where we want to be. Similarly, you can see if you look back, this is just the last 6 months or so. Back in January, we were talking about 10-11% positivity. And let me be clear that some of the states on the travel advisory list have positivities in the 10 to 15% range, okay? This is not a joke. And we saw this come down, get all the way down to 0.4, unfortunately be on the increase again. And in the last month, our very best month to date, 136 Chicagoans still were hospitalized with COVID, and 33 Chicago residents still died from COVID-19. 96 to 97% of the hospitalizations and deaths, as you heard the mayor say, in Chicago and across the country are in people who did not choose to get fully vaccinated. And if you look at the details here, again, this is just June 19 to July 19, you see more cases in Black non-Latinx Chicagoans and many more hospitalizations in Black non-Latinx Chicagoans, and more deaths also in that group. And that is a direct result of both higher rates of chronic disease, but especially still lower rates of vaccination that we're working on. I want to just show two maps quickly. The green here is very good news. And for those of you who have been following along on the website, a lot of this map was green. We had whole zip codes where we were not seeing cases, we were not seeing hospitalizations. But where we're looking, green represents a zip code that has not had a hospitalization, a COVID hospitalization during this time period. But anything that's not green has had cases. And then as the numbers get darker, we see the numbers go up. And you see the concentration there, particularly in areas of Chicago that are less vaccinated. Similarly, our pattern of deaths in the last couple of months, again, only really right in the loop and down by Beverly do we have a few zip codes where we've not had a COVID death. But unfortunately, we still are seeing people across the city, and we're seeing cases in every zip code again. But then again, with some concentration, particularly on the west and south sides. 2/3 of eligible Chicagoans have gotten at least that first dose, and that's 2/3 of everybody over the age of 12. So we're making good progress there for sure, but we need to keep working, especially as we're talking about coming back to school, with vaccinating adolescents. You can see if we look at folks who have gotten that first dose of vaccine, 46% of our 12 to 17-year-olds in Chicago have at least that first dose, and about 34% of 12 to 17-year-olds are fully vaccinated. And the numbers are lower than that where you look at Black and Latinx adolescents. So it's a major focus with CPS to really work on making our school settings as safe as they can be. And I just want to highlight on the other end of the scale, our very oldest Chicagoans, over 80, also are only about 64% vaccinated. And that's really concerning because when people in that age group get COVID, the chances of them being hospitalized is very high. I want to highlight that we are making the most progress in terms of vaccinating Black, non-Latinx, and Latinx Chicagoans. 75 to 80% of the vaccines every week are now going to Black and Latinx Chicagoans. And in our Chicago Protect Chicago at Home program, nearly half of the vaccines through that program have been taken up by Black Chicagoans. We're pleased because we still have some catch up to go. You can see again with that first dose, 40% of all ages of Black Chicagoans have gotten a first dose, 49% of Latinx in comparison to in the 60% range for both white and Asian Chicagoans. And if we look even more by zip code and we actually go by census tract, we're showing some of this, including on the website, because we want to make the point that a lot of this is hyper-local at this point. The work that our canvassers are doing, the work of reaching out, this is about vaccinating within networks. And so certainly there are differences across zip codes, but what this map is showing you, I know you can't see the exact details, but the darker blue represents areas where at least 3/4 of the population has had at least a first dose. Good. The lightest blue represents areas where less than 35% have had at least a first dose. And let me tell you, these are blocks where COVID is growing because of the Delta variant and where it is going to continue to grow. And if we look at seniors, you also see some patchwork here. This is again looking at among our seniors, our highest risk folks, 65 plus. In this map, the darkest blue, again, neighborhood level, these are some census tracts that are 90 to 100% vaccinated. And you can see that there are areas on the south side, for example, that are very vaccinated, thank goodness. But there are other areas, and the lightest blue on this map are less than 45% vaccinated to 50%. And that is not protective enough. And so the work is now about neighborhoods. It's about, if you yourself are vaccinated, talking to your neighbors, your friends, your family about that decision. One good thing that we are seeing with the major surges in some of the other states that are on the travel advisory, that is being driven by the Delta variant, but they are seeing vaccinations increase too. So in fact, Arkansas is now vaccinating more quickly than Chicago is, and that's good because they were very far behind. But I don't want to wait for Delta to get even worse here. We estimate that Delta is around 44% of the COVID vaccine cases here in the Chicago and Illinois, what we call Region 5. And by next month, it will be the majority of cases for sure here in Illinois, just as it already is across the country. So let's not wait for that, because getting vaccinated now is safe, it's effective, and it protects you, your family, and your community. I'll just reiterate, as we look ahead toward Lollapalooza, you need to make sure that you are bringing your proof of vaccination or your proof of a negative test. Reminder actually from the FBI on this, that if you make or buy a fake COVID-19 vaccination record card, you are not only endangering yourself and those around you, but you are breaking the law. And there have been investigations into situations where we've seen some of that. So we're looking forward to Lollapalooza. The great majority of folks who are coming, we expect are vaccinated, and we're doing everything we can to make this as safe as we can. But if you are not vaccinated, you also need to wear a mask in that setting. A reminder, appointments are available all over the city, ZocDoc.com/vaccine and at 312-746-4835. You already heard about the at-home vaccination. We are averaging more than one vaccination per appointment here, which is great. We'd love to see this be a family affair, 4 and 5 and 10 people at a time as we're sending people out for vaccine. And there tends to be a lot of gloom and doom around vaccine, this sense of futility, like why are we still doing this? Why are we still working on it? Haven't people gotten the message yet? But I want you to know that we are doing 20,000 plus vaccinations a week here in Chicago alone. Every single day, there are more than 700 Latinx Chicagoans who make that decision to get the first dose of vaccine. There are more than 500 Black Chicagoans that make that decision to get the first dose. There are more than 300 white Chicagoans and more than 100 Asian Chicagoans. And then behind that, there's second doses and more to come. So we are not done. We've slowed down, but please take the opportunity now to get that vaccine and help protect Chicago. And with that, I'll turn it to Dr. Luna for some remarks in Spanish, and then we'll come back to take any questions. Thank you again for your attention and for spreading the word about the vaccine.
Pick this up.
Thank you, Arwady, Dr. Arwady. Thank you, Mayor. Yo soy la doctora Geraldine Luna y esta parte van a ser en español. Buenos días a todos. Soy la doctora Geraldine Luna, directora del Departamento de Salud Pública de Chicago. Hoy se compartirá información y actualizaciones sobre el aumento de los casos del COVID-19. Lamentablemente es el caso. En todos los Estados Unidos, 50 estados de 50 estados, hemos estado viendo un alza en los casos de COVID-19. Incluso aquí en el centro y al sur de Illinois y aquí en Chicago, ya estamos viendo un alza en esos casos. Y en las últimas 2 semanas se ha visto que el aumento constante de las tasas diarias de positividad de casos y pruebas son continuas. Un aumento que se cree que es causado por la variante Delta. Tenemos la variante aquí, en Chicago. Y por cierto, es altamente contagiosa. El promedio de los casos diarios en Chicago aumentó a 90. Anteriormente teníamos solo 34 casos. Ya tenemos 3 veces más de lo que teníamos hace 2 semanas. Cuando solo hace semanas, como le había dicho, los casos eran mínimos. La tasa de positividad de pruebas también alcanzó las mínimas históricas a fines de junio con 0.4 y ahora otra vez estamos en 1.5% de cero positividad del virus aquí en Chicago. Si bien estas tasas siguen por debajo de los picos, sigue siendo un desarrollo preocupante y no solo queremos adelantarnos, sino queremos acabar por completo con esta pandemia. Estos casos son prevenibles. Esto es una pandemia de los no vacunados. Y la forma de hacerlo de forma contundente y oficial es vacunándote, pero vacunándote por completo. Si estás siguiendo una serie de 2, tienes que completar la serie de 2, porque es la manera de obtener la máxima cobertura y protección contra el COVID-19. Hay 3 vacunas disponibles para todo habitante que ofrecen una protección extraordinaria contra el Delta y todas las variantes que tenemos ahora mismo del COVID-19. Estamos hablando de Pfizer, de Moderna y de Johnson & Johnson. En esta época, el año pasado, fue difícil siquiera imaginar una realidad en la que tuviéramos vacunas. Y mucho menos poder imaginar que esas vacunas ya estaban en los centros de salud. o su farmacia comunitaria. Pero ahora esta es nuestra realidad. Tenemos vacunas en abundancia. No hay razón para que todos los habitantes de Chicago no reciban su merecida protección contra el COVID-19 y acabar con las muertes y los casos incapacitantes de COVID-19. Y todavía hay personas que no han tomado su vacuna. Acuérdense, la prevención y la salud es un derecho, pero el vacunarse es nuestra responsabilidad. Es tu responsabilidad protegerte a ti y a las personas a las que amas. La cuestión no es que solamente estamos viendo un aumento en el número de casos positivos, también estamos viendo un aumento entre las personas no vacunadas. Y dentro de las áreas donde las tasas de vacunación son las más bajas, ahí estamos viendo otra vez repuntes, otra vez casos surgiendo. A nivel local y en todos los Estados Unidos, casi todas las hospitalizaciones y muertes del COVID-19 ocurren en personas no vacunadas. Y ahorita, de un 96 a un 97% de todas las personas que están muriendo con una enfermedad que se puede prevenir son porque no están vacunados. Además, también se comienza a ver un aumento en la transmisión en las personas menores de 40 años. Estamos viendo que la transmisibilidad es 2 veces más que la alfa, es altamente contagiosa. Por favor, protéjanse. Así que, por favor, si aún no lo ha hecho, vacúnate y vacúnate completamente. No te quedes a mitad de tu régimen de vacunación porque te quedas desprotegido. Hay vacunas disponibles en los centros de salud, en su farmacia. Inclusive estamos yendo a las casas. Solamente tienes que llamar a un número que te voy a dar a continuación y puedes recibir las vacunas en tu hogar, con tu familia, en un ambiente celebratorio. Quiero aprovechar este momento para recordar a la gente que existen varios recursos en la ciudad que están disponibles para vacunarse de la forma más simple y fácil posible, sin citas, sin que se le pida identificación que lo ponga en riesgo. Está adecuado para todas nuestras comunidades, incluyendo las más vulnerables, nuestros indocumentados, refugiados y no asegurados. Puedes recibir Pfizer si tienes 12 años o más y Johnson & Johnson si tienes más de 18 años, o 18 o más. En la iniciativa, estas iniciativas están basadas en cita en su hogar y tenemos vacunas para vacunar a todo el que nos llame. Se pueden vacunar hasta 10 personas por vez, lo que significa que puede invitar a otros miembros de su familia, a sus vecinos, amistades. Y para recibir una cita, por favor, llame y tome nota. Es el 312-746-4835. Repito otra vez, 312-746-4835. O puede visitar a chicago.gov/@home. Tan sencillo como eso. Por favor, no se demore más y vacúnese hoy mismo. Y por favor, muchas gracias por recibir este mensaje y manténgase a salvo, Chicago.
Thank you, Dr. Luna, and we're happy to take your questions.
Thank you very much, Mayor. Appreciate that. Members of the media, we're going to have 2 questions per reporter. Please respect that because we want to make sure everyone gets a chance to ask their question to the mayor and to the people that are present here. My colleague Alejandra will give you the mic, and please, Ivy Martinez from Telemundo, get out for us.
Oh, hello, Iris Barrios with Telemundo. This question, yesterday, Dr. Allison Arwady mentioned that she has a big concern about
I'm sorry, who?
Arwady.
Oh, yes, Dr. Arwady. Okay.
Mentioned that she has a big concern about the surge in cases, especially for the fall. Next week is Lollapalooza, and obviously the fall is coming. What is the city doing to prevent the cases going up?
Well, let me start, and then I'll obviously turn it over to Dr. Arwady. Part of why we're here today is to emphasize to folks that we're starting to see this uptick, and we want to get ahead of this before we see truly a second surge. So educating people about what we're seeing in the data and really highlighting that is a big part of it. And we continue every single day to do a push for vaccinations. You heard about our Protect Chicago at Home program. We're literally going door to door. We have canvassers going to areas in our city where we see limited vaccine uptick to talk to people, help educate them, hopefully disabuse them of some myths that still remain out there, but importantly, to get people ready access to the vaccine. Dr. Arwady, I don't know if you want to add to that.
I would just add that, we have been expecting, most likely, as we move into our typical cold and flu and respiratory virus season, that COVID is going to be a part of that. And what we are seeing now is a real increase. It is still an increase that is in reasonable control, as I hope I showed. But what we want is to have people hear this and decide to take that preventive action now. Certainly around Lollapalooza, as you know, from the time that it was first announced, we were really pleased to partner with Lollapalooza with their decision to require vaccination or negative tests for attendees, and that certainly adds a level of complexity to the situation. But we want people to have a good time, and we want this to be as safe as it can be. And so certainly we'll be watching that, just as we do any other gathering. But I am more concerned about the many, many people who have not chosen to get vaccine, especially if they're older, here in Chicago, and hoping that they'll make that decision.
Doctor, before you go, can you pull up I think it may have been slide 12.
Which one?
12 maybe?
About what?
Keep going. Okay. So I asked Dr. Arwady, just to follow up to your point, to pull up this particular map. Obviously, Dr. Arwady and her team, the epidemiologists, they're following these numbers every single day because it's so important. But I also follow these numbers. And this map, looking at where we've seen uptick in vaccinations, this is what guides us and guides our data-driven approach to COVID-19. We follow these numbers very, very closely, and this really determines how we're allocating resources, where we need to continue to build relationship with local stakeholders, where we need to go literally door to door to bring people into care. That's our big focus.
Yes, my point is, okay, now.
Go ahead.
My point is that I understand that the city is going door by door. The state are doing the lottery. But today, for example, Cook County is closing 2 of the mass vaccination centers, and even the vaccine is available. People who are not vaccinated, they're not probably doing an effort to get it. Maybe they're against of it. So my question is, what the city is going to do to convince that people to get it?
Well, I think we're going to build upon the lessons that we've learned over the course of COVID, and I'm sure Dr. Arwady will have more to add on that. What we're seeing, not only here in Chicago and Illinois, but really across the country, is to pivot from these big mass vaccination centers, because frankly, we're not seeing a lot of people going to them. The people that really wanted to get the vaccine, or we needed that extra capacity, we're in a different phase in vaccine distribution than we were before. What we're doing really, again, varies by neighborhood, but at baseline, we're educating people. We're trying to answer their concerns and their fears. We're continuing to talk about how the vaccine is safe, and that they know someone now in their network that has had the vaccine and had a safe reaction to it. We're very different place than we were, say, in December or January. We're still a fairly small percentage of people in the city had taken the vaccine. Now, I think any Chicagoan would be hard-pressed not to know somebody in their family, on their block, at their church, at their workplace that hasn't been fully vaccinated and come out on the other side feeling just fine. And we know from the data being fully protected. That double dosing is critically important, but we still have people that even haven't gotten the first dose. So reaching back out, working through community partners, the network and infrastructure that we built up really starting back in March of last year, we're still leaning very heavily into that. And you can see the areas on this map that are light blue. That's a lot of where our focus will continue to be on the west side and obviously significant portions of the south side. I don't know, Doctor, if you want to add anything.
I'll just add that there is a lot that continues to go on in the vaccine space. There's 40 to 50 sort of pop-up events that the city alone is standing up this week, next week. We continue to be at CTA stops. We continue to be in churches. We continue to be in a lot of these spaces. But frankly, it doesn't make sense to have large centers open when you're doing single-digit number of vaccines. And we are seeing such good uptake with our at-home vaccination, where there are people, who have made that decision, that we are working to pivot actually additional resources from some of these larger centers to be able to increase that capacity, because we've been really pleased how all over the city, a third of the people are in that over 65 group. We've got plenty of kids also getting it done. I think one other piece is, we continue to try to give information and reassure people. One thing I heard from a lot of folks is, I want to wait and see. And we heard that there were people who said, I feel like I want to know the vaccine's been around for a year before I'll feel comfortable. Well, let me tell you, next Tuesday, 1 week from today, marks the beginning of the Pfizer vaccine trial here in the U.S., meaning that it has been a year, a week from today, that we have been following, in the Pfizer trial, more than 43,000 people very, very, very carefully, not identified safety concerns or efficacy concerns. And we're at a point now where we've given literally millions of vaccines in Chicago, hundreds of millions across the U.S., billions around the world. And I feel so lucky that we have this vaccine that is really safe and really effective. But it's about making it convenient for people and trying to correct some of the misinformation that we still hear.
Sarah Schulte, ABC 7, go ahead.
Should CPS students, all students vaccinated, wear masks in school in the fall?
So before I directly take that, let me remind people that Monday, in terms of deadlines, is also, if you want your child over the age of 12 fully vaccinated by the time CPS starts, Monday's your deadline. So if you've got a 12 to 17-year-old, remember, fully vaccinated means 2 weeks post your second dose. And for 12 to 17-year-olds, Pfizer is the only vaccine that is available. So just a quick deadline and a thing to shout out there. So certainly we are in conversations with CPS and with all of the other private and parochial schools here in Chicago. What I will tell you is that I was pleased with the CDC guidance that came out around schools. First and foremost, they said, we want to show, from a data-driven perspective, children should be in school in person. And I think this is something that the Chicago Department of Public Health has been really encouraging in a data-driven way for months and months and months and months. And they really said this should be a decision at a local level. I want to be clear that nothing has happened to the CDC guidance that said unvaccinated people need to continue to mask. And I will also say in Chicago, like I showed, less than half of adolescents have gotten a first dose and less than a third are fully vaccinated, or just over a third are fully vaccinated. And so there are real operational questions around what it would look like in a setting to make that decision. So we continue to talk with CPS, and they'll be making an announcement, as will other schools. But we are encouraging, really making sure that we're doing everything we can, first and foremost, to have parents and guardians feel comfortable about having their children back in school in person to make up some of that learning loss and work on the social and emotional piece that is so critical.
We only get 2 questions here, so is this it? My second question here?
Yes. Go ahead.
Okay. Kind of back to getting people vaccinated. Does the city have a plan to refute all the misinformation that is going on out there on social media? That seems to be almost the biggest enemy at this point. Is there an actual plan to do something about that? Yeah,
we're doing it, part of it right now. We're standing in front of folks. We have been putting, I think, accurate information out on our websites, through our social media channels, on and on and on, really from the very beginning of the pandemic hitting Chicago. It helps that we now have a administration in Washington, D.C. that is focused on the facts and the truth and not spreading misinformation. I can't even begin to tell you how incredibly important that is. But yes, there's a lot of misinformation out there. We're talking to our federal electeds and social media companies about being much more aggressive about tagging or taking down information that's just factually inaccurate and could cost people their lives. But at the local level, we're continuing to fight this fight with the facts and the truth.
Aaron, Hyde Park Herald.
Hi, for Dr. Arwady, please. Mm-hmm. This is going to be kind of a lot of background, but I want to make sure I get myself exactly clear with this. I went out and canvassed in South Shore, or watched the canvassers in South Shore with the Protect Chicago program. They're only going to single-family homes. They said the reason that they're doing this is for safety and access reasons, that they can't go into private apartment buildings because they can't get into them. But the issue that I saw is that people who live in single-family homes are mostly older people, and older people are more likely to be vaccinated. The data has shown that out. Younger people are the people who need to be getting vaccinated at this point because they're less likely to be vaccinated. First off, is it policy for Protect Chicago everywhere that they're not going into apartment complexes? Is that going to change at any point in time? And then furthermore, is the program going to expand into other neighborhoods throughout Chicago at any point in time? You can see on the Mid-South side, South Shore is the only Mid-South side neighborhood that the program is currently in, but Woodlawn, Washington Park, and Bronzeville are also under-vaccinated neighborhoods at this point too. But you say going door to door, they're not really going door to door in every neighborhood because they're not going into apartments, at least in South Shore, and I don't know if they are in every other neighborhood where this program is operating right now either. And not hitting people who need to be vaccinated because of that. And went for an hour, every door they knocked had already been vaccinated.
Okay, sure. So I'm glad you went out with the canvassers. I think it helps to understand sort of what these conversations are like and the work that they're doing. So we do have a policy that our Protect Chicago Plus canvassers stay outside of homes, and that would include not going into a private setting in terms of access and who is there and safety and making sure they're in touch with each other, et cetera. There's been other work that we've done, particularly with BACP, around multi-unit buildings where there tends to be more engagement. Where there are apartment or condominium buildings, there is often more involvement, regulation, et cetera. And so we've often, if you think back earlier in the pandemic, we were trying to limit the size of gatherings where we were doing that, trying to make sure that through the building managers, there is information that is getting out so that people know how to get vaccine. In terms of where we're going, so already we focused on the 13 least vaccinated communities, and that is where we've started. And we're really working to evaluate some of this to understand where it is most effective. And what we're seeing is that it is helpful to go door to door. It is certainly where there are people who have, who have barriers. We're getting folks signed up and we're pleased about it. But there are also the people who open the door in a lot of cases are perhaps the ones more likely to be vaccinated too. And so there are multiple ways to sort of get at this. And the number one bricks and mortar place that people are being vaccinated in Chicago is in pharmacies still, right? And so really just making, it is not hard at this point, I think, to find a vaccine. It's more having that conversation with someone who is ideally from your neighborhood, who you trust. And we're thinking, in addition to door-to-door, other ways, including through social media, to the other question, to be really getting out sort of some of the stories and some of the correcting of misinformation and my decision on, why I maybe was hesitant and made that. So certainly the at-home is part of this, but Protect Chicago at-home, the door-to-door is part of this, but Protect Chicago at-home is available to anybody in the city of Chicago. And we're seeing really good turnout from it. And like I said, we are vaccinating still thousands of people a day.
But in terms of bringing the mountain to Mohammed, what ways are you bringing it to 12 to 45-year-old Chicagoans if this door-to-door access isn't getting to them? Are you going to be working to getting face-to-face access to these people, given how effective it is?
So,
in terms of not going.
Yeah. So we've not. Yeah, we've really not dropped any of the pieces of engagement that we've done to date. So there remain at this point, although they will be, they're in the process of winding down. There are some of the sort of large come at any point city of Chicago. We've continued to enroll providers. We've also continued to work with employers, and I think particularly as as many more people are coming back to work, that is an interest where people are wanting to be concerned not just in their neighborhood but in their workplace. And so we have actually here in Chicago, compared to most of the country, quite a bit higher rate of vaccination among frontline essential workers. And that's because of some of that early work we did with Protect Chicago Plus. So we feel good about that in terms of that space. But I think the work through employers, through unions, where we've continued to meet with them, through advocacy groups. I was on something with the AARP yesterday, for example, with some of the subgroups of people who can take the public health voice but are already trusted. And we're really trying to do that with our network throughout the whole city.
Amy Jacobson, go ahead.
Good afternoon. Dr. Arwady, I have a question for you first. So we went from 0.4 to 1.5 positivity rate. So, mainstream reporters say, our positivity rate has tripled because legally, it has tripled when you go from 0.14. 1.5 is still good. The Delta variant, we know it's more contagious, but is it more lethal, or does it lead to more hospitalizations? 83 in the hospital. How many of those have the Delta variant?
Yeah, so as we continue to have more variants, the biggest concern about the Delta variant, as you said, it is very clearly more contagious, and not just a little bit more contagious. It's about 50% more contagious than the Alpha variant was, which itself is 50% more contagious than sort of the OG, the one originally from Wuhan. And what we therefore see is that the reason why Delta is on the increase here is because it is more contagious. So where there are no masks, no vaccines, no nothing, no anything, the original version of COVID, somebody would transmit it on average to about 2 to 3 other people. The Delta variant, in the absence of vaccine, in the absence of masks, in the absence of any mitigation, would instead transmit to more like 3 to 4 people. That may not sound like a lot, but a transmission to 2 people means a doubling of numbers, and a transmission, to potentially 4 people, really you see this exponential rise very, very quickly. And so we are seeing more cases of Delta in the hospital, but not disproportionately. So we have not seen data at this point, and this has been one of the things scientists have been studying around the world. It's not that it makes people sicker necessarily, but you're more likely to get infected, to start with. And then because there are more older people who are vaccinated, for example, if you look over the last month, 2/3 of the cases are in people under 40 and 1/3 of the hospitalizations are in people under 40. That's really different than what we saw earlier, but that's Delta driving it only because it's more contagious, as opposed to a lot of evidence that it's making people sicker. Does that make sense?
Yeah. No, that does. Thank you very much. Mayor Lightfoot, can I talk to you? Considering we had heard that Lollapalooza, if you didn't hold Lollapalooza this year, the organizers were going to pull out and go to a free state. So that's not true. Okay. No. Do you regret, knowing that the positivity rate is on the rise, do you regret allowing Lollapalooza to happen next week?
No, I think we made the best decision that we could, as always, based upon the data and based upon projections and modeling. We felt very comfortable on June 11th, which was the date, fully opening up the city. We had been kind of working towards that point, looking at trends in the data. So no, I feel like we made the right decisions, but we're sounding the alarm today because we're starting to see this uptick. And we've seen this before, right? We saw the initial surge back in March and April, May of 2020. We started to see the downward slope of that infections over the course of the summer, early fall. We saw the massive spike back up in October through, I think, January plus, and then we started to see, frankly, in February, the downward slide. That roller coaster ride that we've all been on has been extraordinarily difficult. It's difficult on all of us physically, emotionally, but it's really difficult on our businesses and our workers. Knowing what we now know about this virus, particularly Delta, we wanted to sound this alarm today so that people understand it's still here, it's still real, it's still deadly, and it's really attacking people who are unvaccinated. So we just got to keep pushing that message. Get vaccinated. It will save your life.
Gaynor Hall, WGN.
Dr. Arwady, can you talk to us about the number of breakthrough cases you are seeing, and are you concerned about that at this point?
Yeah, certainly. So first, if everybody doesn't know what a breakthrough case is, we call it a breakthrough when there is someone who is fully vaccinated but who still develops COVID. And we are tracking here cases and then especially hospitalizations and deaths. And let me tell you a little bit about how we do that and how concerned we are about that. So every single time someone is diagnosed with COVID in the city of Chicago, we match it back. We say first, is this a first-time COVID diagnosis for this person, or is it a repeat COVID diagnosis for this person? If it is a repeat COVID diagnosis for this person, we're worried because might this be a new variant where they're not having the protection, that you have certainly some protection after an initial case. So we do additional investigation, work to try to get that sequencing, do more contact tracing, case investigation. And then secondly, we match every single case against vaccine records. And when we identify a case that has a record record of being vaccinated, particularly fully vaccinated. We again are doing extra investigation work into that, and especially if they end up, being hospitalized, to the question of, are we concerned about variants potentially making people sicker? There's extra work that happens from an epidemiologic perspective, and then also from a sequencing perspective to really make sure we know what's happening in terms of the variants here. So we are seeing breakthrough cases, which is not a surprise, because remember, there's no such thing as a 100% protective vaccine. And these vaccines, in the biggest trial with the Delta variant out of the UK, when it was about 95% plus Delta variant there, we saw the Pfizer vaccine after 2 doses was about 88% protective. That's a little bit lower than it had been originally. Originally, it was 93, 94%, and you lose a little bit. And so that means that we would expect, broadly, 88% of the people who are exposed to COVID and fully vaccinated not to be infected with COVID, but about 12%, if they get a true exposure, might be infected. The other piece that we've seen that. We've certainly seen some breakthroughs. But it's important to note that the most important thing the vaccine does is protect against those severe outcomes. So often, and I know this has been in the news a lot, people have been talking a lot about, somebody knows somebody who got COVID. It is really not common at all for someone who is fully vaccinated to be hospitalized or to die, right? This is where that 96, 97%, that includes all of the variants. It's also less likely that if somebody is fully vaccinated and they were to get COVID, they're also much less likely to spread it. So we're following it, but we've not seen any sign that any of the vaccines are not protecting in the way that we would expect. But it's just that no vaccine is 100% protective. And so the worry, when we've got numbers like we've got now, the risk for somebody who is fully vaccinated is very, very, very low in Chicago. The risk for someone who is unvaccinated is kind of in the moderate risk range, I would say. And as our numbers go up, the risk in both of those groups rises, but it would go from very, 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 very low to very, very low for people who were vaccinated. And it would go from moderate to high to very high quickly for people who are unvaccinated. And as more people get vaccinated, it improves the risk for both of those groups. And that's what some of the conversations are in some of the, in Los Angeles, where they're having more than 1,000 cases a day again. That's why they went back to the universal masking mandate, because the risk is getting high enough, even for people who are vaccinated, that they're more worried. So I'm a little concerned about what the future could hold. Right now, I'm feeling confident, and all over the country, we are seeing the vaccines perform just as expected. And the most important thing, if you want to protect yourself, is to get that vaccine.
With Delta, are you considering taking any further steps as far as requirements for Lollapalooza attendees, for example, universal mask wearing at a full capacity?
So, as a reminder, from the beginning, when Lollapalooza was announced, we were really pleased that they were serious about wanting to have this be, an event that took COVID seriously. And so the requirement to show vaccination, and as you know, we did a number of Lolla giveaways and Lolla promotions, et cetera, to really get the word out that vaccination is the best way to safely enjoy this event. But to require the vaccination or the negative test is really the best option that we have available at this point. It really is. And I think with the level, of COVID that we have here, we remain here in Chicago right now at this low to even controlled risk state. I do expect that it will go up, but we do the best we can in terms of trying to protect against COVID, and this is absolutely the best thing, that can be done. For people who are unvaccinated, certainly I would recommend masking, and anybody who's concerned, I would encourage them to choose to mask, but there's not a need to recommend universal masking at this point.
Chris Ty, Channel 2.
Mayor, question for you about following the data. And, mass vaccinations are no longer working in the way that we saw before. Does the pivoting also affect the messaging here? Is there a point in time you've had any conversations about a little more stick and a little less carrot to get people to get where they need to get here? In some pockets, there's talk of, on the federal level, holding a child tax credit, to incentivize folks. Have you entertained anything along those lines?
Well, we've looked very carefully throughout the pandemic at methodologies that have been used all across the world, and how you incentivize people. Early on, it's to educate themselves, to stay home, save lives. So we've looked at every possible permutation from literally China all across the globe. We also have to recognize that we're a democracy. Certain things that have been effective and worked in other countries with different cultures, different forms of government, are not going to work here. So we've tried to take the best practices from across the globe and adapt them here. What I think I have seen is the stick is really difficult for people, and particularly now, since we've been open. What we really want to do is educate people and get people to care not just about themselves, but about their family, about people in their social network. Because what you do, and you've heard us all say this before, this is one disease that what somebody else that I don't even know does affects me. Same thing with you. So we are literally in this together, which is daunting at times, but I think and also a real opportunity to make a difference. So I think what we've done over the course of this 16 months has served us well. I don't see us deviating from that. Clearly, we've made modifications depending on what the data tells us at a particular time, and we've made modifications depending on what community within the city of Chicago at a hyper-local level that we're going into. But the basics, I think, that we have established have served us well. We need to keep doing the work, but we've seen extraordinary progress. Again, looking at this map, a year ago, this map, in terms of cases, and this is obviously vaccines, but in terms of cases, look entirely different. I mean, we devoted a tremendous amount of energy trying to educate and be in community in the northwest side, for example, the Belmont-Craig neighborhood, on the southwest side, throughout Black Chicago, because we were seeing this virus really wreak havoc in these communities, and the communities needed more support from us to make sure that they were protected. So I think we've learned a tremendous amount, and I will again give credit where credit is due to Dr. Arwady and her team. Other cities and the CDC have come to Chicago to learn from us about how we've done a variety of different things. Papers have been written by Dr. Arwady and her team explaining some of the things that we've done to educate people, to break down barriers, and also about our equitable vaccine distribution process. We have been a leader in this country for sure, and I would say across the globe, in some of the really innovative and unique things that we've done to reach people. But as this map shows, we've got a lot more work that we need to do.
One question off topic. I wanted your comment on a former federal prosecutor who's in charge of overseeing court-ordered reforms in the Chicago Police Department, writing today, the Chicago Police Department was unprepared to handle the mass protests, unrest, violence, and looting that followed the murder of George Floyd last summer. Your comments on that? I
assume you're referring to the Independent Monitor's report that was issued. I haven't had an opportunity to read the full report, but the Chicago Police Department itself put out an after-action report that I think highlighted the fact there was no city in the country, us included, that anticipated the scale of protests following the murder of George Floyd. And protest is really inaccurate. What we saw is a cycle of three things. We saw peaceful protests hijacked by vigilantes, and then we saw looting. And that cycle repeated itself over and over again from the end of May into early to mid-June. We had not seen anything like that on that scale across so many neighborhoods in Chicago, maybe ever, but certainly not since the murder of an assassination of Dr. Martin Luther King in the late 60s. So we prepared for a large-scale protest. What we got was something very, very different. Now we had to pivot, and I think we learned a tremendous amount because of the experiences of that fateful 2 to 3 week period from the end of May to the beginning of June. We applied a lot of those lessons learned, both in terms of crowd management, making sure that we're respecting people's First Amendment rights to peacefully protest, but also in terms of being prepared for the dark side of what we saw, which is people coming into our city to wreak havoc, and the criminal looting that took place. If you think about late summer and fall, there were a lot of other potential flashpoints, not the least of which was we anticipated protests, win or lose, following last November's election. Luckily, it was peaceful here, but we were well prepared. Backing up from that, when the grand jury announced the verdict in the Breonna Taylor case, we expected residents here, and we were ready. This year, when the Chauvin trial concluded and the jury rendered its verdict, we expected that there would potentially be some large-scale mass reaction to that verdict, regardless of what the outcome come. We were prepared. We were prepared because of what we experienced last year. We were prepared because of the tabletop and live exercise drilling. I mean, we literally would, the police department would, issue a call at 6 o'clock in the evening, unexpected, to an incident coming downtown, to see how fast people responded, how fast they got in place, what the reaction time was. So there was a lot of learning that we gleaned from last summer's experiences that I think we've put to good use in being better prepared, better able to respond, and making sure fundamentally that we're respecting people's First Amendment rights and keeping our residents safe, but also being very prepared if we see any recurrence of the vigilantism or the looting.
Thank you, Mayor. That concludes our...
It's back to
Thank you.
It's back. On June 11th, you felt comfortable making that decision. If you had to make this decision today about Lollapalooza, would you make the same decision?
Yes. Yes.
Okay.
Yes.
Thank you very much, guys.